This daily health systems transformation video for about a month now. My goal was to, well, my overall goal is I want to look back when I'm on my deathbed, I guess, at 87 or 72 years old or whenever I die, and just feel like I've made a positive impact in the world. So I'm an ER doctor. I'm on a journey to transform and understand and learn our health system. So the first reason I decided to do these daily videos was frankly because I was burnt out. So I've spent the last 7 or 8 years researching and writing about two doctors that lived in 1890s Raleigh, North Carolina. And so I was doing a lot of primary research, historical research, looking up old newspapers, and it was fascinating. Love the history. I think it's important because that was a time in history when there were so many possibilities: germ theory, hospitals, nursing, medical specialties, everything was new. And I thought there was a lot that we could learn from that today. So I've made a lot of progress on that book, but I'm way over my head, and I'm not a professional writer and I'm not a professional historian, but I'm trying to be both of those. But I got burnt out. So I got to a point where I couldn't, I would just sit down to write or to research, and I just couldn't do it. So I thought, well, if I created videos every day, it would just force me to kind of get nervous a little bit and to share my thoughts and get feedback, and that would be a positive thing. And that's happened. So I'm grateful for that. Grateful for you guys. So I think I have 500 followers on YouTube, almost 11,000 on TikTok. I think about 300 people are returning to my videos on YouTube. So it seems like some people are finding value to this. So thank you. I'm grateful for you guys. The second reason I decided to do these daily videos is to learn. So I have kind of an eclectic background. I'm an ER physician. I also have a master's in public health. I also published papers and academic papers and taught around complex systems thinking. And then finally, I've been writing this book. So I've kind of immersed myself in the historical time period of the 1890s. But there's a lot that I talk about that I just don't know that much about, from policy to sociology, to psychology. There's just a lot I don't know about. So I'm here to kind of learn as well. And I'm grateful for you guys. I've learned from you, and in preparing these on a daily basis, I learn as well. And then the third reason I'm doing this is, of course, I think that I have something unique and valuable to share with the world. So I hope that that's the case. So please let me know about any of those two things. If you feel like, if you have feedback for me, or you feel like I can do things better, I'd really appreciate it. I have a few things that I've experienced. So I think that creating these videos has been challenging. So it forces me to put myself out there and prepare, say things that I think are interesting or valuable. It doesn't come naturally to me. But hopefully over time I'm getting better. I've also learned, it seems to me, that especially on social media maybe, and this is something I knew, but now I'm experiencing, it seems that we really have a tendency to categorize people and to be very tribal. And I'll just give one example. I've shared some videos on equity recently, and on the one hand, on the one extreme, some people would dismiss what I'm saying and say that that I've never experienced discrimination, which is probably largely true, but I don't know how they could know that. And then they'd also say that I'm coming from a privileged background, et cetera, which I am as well. But I'm concerned that there isn't adequate really consideration of the humanity, so the people behind these comments and videos, and the fact that our experience may not reflect other people's experience. And so I view this as really a significant challenge that we as human beings are facing here on planet Earth. And that is that we too often let our tribal allegiances or our emotional responses dictate what we believe as opposed to the facts or logic or our humanity. So I'd like to know what you think about that. If that's what if that's what you've experienced or seen as well. On the other extreme, with equity, of course, there have been others that have responded with equity is always vile. It's something that will lead us towards, I don't know, communism or something horrible on a political perspective. I've realized that there are social and political threads of information that are out there, and none of us could be aware of all of them, but I think the whole idea of equity helped me to realize that what I had conceived as equity, so this idea that we should aim for a state where there is just and fair opportunity for all to gain optimal health, that seems pretty straightforward to me at some levels. I don't think anybody would argue with the value of me treating a baby who's having a severe asthma exacerbation or something and is about to die, despite their ability not to pay, or rising up as a community to support the health of someone with disabilities, or the value in and aim to address the health needs of homeless people with schizophrenia. So I think there's a number of examples where it's just clear cut, and yet when we bring up that word, there's triggering words, I know. We bring up the word equity and then suddenly we're categorized and dismissed or labeled, and I think that's a shame. But I'm going to keep dealing with that, and appreciate your feedback and thoughts on that. So I've thought a lot. I think so. I've shared a number of recommendations. So I've recommended that there be universal, basic, free health insurance for all, and I was convinced by a book called "We've Got You Covered" that makes that argument. I've also made the case for a mandatory pre-med major in health systems transformation. I've also made the case for competency-based board certification and licensing for physicians. What else? I've made the case for a number of recommendations, but really for me, it's all about just this relentless focus on a system that can deliver health and well-being for all at the lowest possible cost for the system. Now, I recognize when I say that, many people are going to jump to, well, I don't want the government too much in my healthcare, and I'm not necessarily saying that. So for me, a system is just all the people and organizations that influence health. It's not necessarily the government. Now, that's a different and important discussion. I think other people will jump to, well, racism is the only issue or the major issue or something like that. And so I'm concerned that we are in a place in our society where certain issues are receiving so much attention and focus that we distance ourselves too much from truth and data and conversation and communication, and that's a shame. And I say we because I put myself in this category as well. So I find myself becoming a little bit emotional or defensive when I read some of the comments. It's gotten to the point where I need to set aside 3 times each day, about 10 minutes each time, where I dedicate that to social media, and then I just don't check it or look at it any other time, because I find myself thinking too much about what somebody said or how I would respond, and then that takes me away from time with my family or time outside to enjoy just the peace and quiet of that time. So my hope is that through it's helpful for me to occasionally, like I'm doing now, occasionally to take a step back and say, okay, what do I really want to get out of these videos? And what I really want to get out is to make the case for everyone, whether you're in health education, whether you're just a father in a community trying to improve the health of your family, whether you're working in a clinic or a public health agency or in politics. I think that we need to raise the level of importance of raise the level of importance of a system with a vision for health for all at the lowest possible cost. Even though we feel the urge and we feel the need to treat individual patients like I do in the ER, or teach a specific class, or develop a specific project and deliver it in public health. There are all these, or remain comfortable with the current status quo, or maintain loyalty to our political tribe or other group that we are loyal to. I think there is a need. I'd love your feedback. I think there is a need to step outside of those groups and think how our number one is what I believe based on facts and science and logic and humanity, and then number two, how does what I believe interact with the other groups and organizations, and are we, despite all this uncertainty, despite all this messiness, despite all of our flaws and limitations as human beings, are we moving towards this goal of health and well-being for all? Because I think that's very important. Thank you.